in physio, there's also manual treatment. And sometimes that could be quite similar to massages, right? People would confuse that. Is there also a distinct differentiate between the two?
Yes, there is. Yeah. And so that's a really funny point that you bring up, because a lot of people, that's what they think physios do, that we just do massage and that's all we do. It's not quite the case. We do a lot of exercise prescriptions. So going over different exercises, because the thing with manual therapy or soft tissue work with massage is it makes things feel better and it gets things loose, but it's only temporary. And you kind of have to do things like exercises to strengthen muscles and address imbalances. And so the difference between a massage therapist and a physiotherapist is we've got more, we've got the exercise prescription, we have the manual therapy that we can do. So, one massage is one part of the manual therapy we can do, but other things like, if you've heard of physios doing acupuncture or using TENS machines or using ultrasound machines.
IMS.
So yeah, exactly. IMS needling. These are all bigger scopes of practice that massage therapists might not be able to do in their day-to-day practice. And then aside from that too, the physiotherapist has quite a big role outside of what we normally think of in terms of a private practice physiotherapist. And we do the hands-on after an injury. Like there's a whole other scope of physiotherapists who work in the hospital, which is part of what I do. And you cannot work in a hospital as a massage therapist unless you have signed special papers saying that you can go in as a third party.
You guys mentioned the word manual therapy a couple of times. I don't know what it means. Is there also like an autotherapy? What does it mean?
And so manual therapy is kind of anything that you really do with your hands is how I interpret it from a physiotherapist. And so it can be things like massage. It could be things like using needles, like with your hands to kind of loosen muscles. There's something called joint mobilizations, which is, you're going at the joint capsule and you're moving specific things at the joint level. And all of it is kind of to help manage pain or to get something tight that's looser so that you can be in less pain and do the things that are important to you.